Okay, so discussing Graves' disease. Graves' disease is basically an autoimmune disorder which affects the thyroid gland. It was named after Sir Robert Graves, who first discovered it in the 19th century. If we talk about the prevalence, it affects one in about 200 people. Now, discussing the pathophysiology, Graves' disease basically results from immune system dysfunction. That is, antibodies form, okay, which include thyroid-stimulating immunoglobulins, TK, which stimulate the thyroid to produce excessive thyroid hormones. This excessive thyroid hormone production results in hyperthyroidism, which results in symptoms such as rapid heartbeat, weight loss, tremors, and anxiety. Now, clinical manifestations that we have are basically hyperthyroidism symptoms because of excessive TSH. So we have weight loss, heat intolerance, sweating, palpitations, tremors, and fatigue. We also have the eye problems, which are included under Graves' ophthalmology. Eye problems like bulging eyes, exophthalmos, double vision, and eye irritation. The dermatological signs that we see are basically skin changes like peritibial myxedema, which is the thickening of the skin on the lower leg. When we come to diagnosis, first we do blood tests, which we measure the level of thyroid hormones, T3, T4, and TSH. Then we do thyroid imaging via ultrasound or radioactive iodine uptake test or thyroid scan to basically visualize the thyroid gland. The clinical examination includes basically the identification of symptoms such as goiter, which is the enlargement of the thyroid, or the eye changes that we have discussed before, exophthalmos. Treatment includes medications, which include antithyroid drugs like methimazole or propylthiouracil to inhibit the thyroid hormone production because there's excessive TSH production. Radioactive iodine therapy destroys thyroid tissue to reduce the thyroid hormone production. And the last resort is thyroidectomy, which is the surgical removal of the thyroid gland in the most severe cases. What are the complications that comes along with Graves' disease? Basically, we have thyrotoxic crisis, which is thyroid storm. It is a life-threatening condition with severe symptoms like fever, rapid heart rate, and confusion. It can we can also get heart problems, increased risk of atrial fibrillation and heart failure due to excessive thyroid hormones. Then we can have eye complication. Severe cases of Graves' ophthalmology can lead to vision loss. What is the management of patients diagnosed with Graves' disease? Long-term management involves the regular monitoring of the thyroid function, adjusting medication as needed, and a multidisciplinary approach includes involvement of endocrinologists and ophthalmologists and other specialists to cater the patient accordingly, along with the symptoms that they're displaying. Prognosis with basically the treatment. With proper treatment, most patients can lead in normal lives, although some may require an ongoing management. Then finally, if we conclude everything, Graves' disease basically poses significant challenges due to its complex nature. Like it involves eye problems, it involves heart problems, it involves weight loss, heat intolerance. Early diagnosis and appropriate treatment are crucial for managing symptoms and preventing complication. Continued research is being conducted to develop better treatment strategies.